So you might now have heard about TSW, but are you confused about what we can actually do to treat it? Well, this is the video for you. Hey again, it's Dr. Eve, and welcome back to my channel, Dr. Eve Skin. Today we're going to be diving further into the topic of topical steroid withdrawal, or TSW as you may well know it, and how you can manage it and endure your TSW journey. I've already discussed what TSW is in a previous video, so if you're more interested about what that is, please do feel free to watch the video here, and I'll be happy to continue on with the topic. So, how do we treat TSW? Unfortunately, there's no one-size-fits-all method of treating TSW, and it's very much an individualized approach. The primary medical approach is to gradually discontinue the use of topical steroids under the guidance of a medical professional using alternative treatments that don't contain steroids to manage your symptoms. You may be recommended a number of varied treatments, including things like moisturizers or gentle skincare routines, and other non-steroid-based medications to manage your symptoms as the skin weans off the steroids. However, it's important to remember that you need to consult a trained medical professional who understands the management of TSW for personalized advice on how to manage your symptoms. Now, there are varied other approaches within the medical community as well as from patients on how to tackle TSW, most of which are aimed at symptom management. So I'm going to be covering some of these in this video as we move through the symptoms one by one. Firstly, to alleviate itching and burning, we often recommend antihistamines. Antihistamines are exactly as they are described, against histamine. These are over-the-counter medications which can help to reduce itching by blocking the action of histamine in the skin, which is the main chemical signal that causes the skin to feel itchy and swollen and leads to symptoms associated with allergy. Non-sedating antihistamines such as things like fexofenadine, cetirizine or loratadine have been proven to work effectively in controlling itching. Very classic things like cool compresses are really simple, effective things you can do at home to remedy and to give you immediate relief for your skin when it feels like it's burning. The cold sensation can help to numb the skin temporarily, thereby providing you with immediate relief and reducing the sensation to want to itch, as well as the inflammation that is under the skin that's been applied. Temperature regulation is also very, very important to the management of TSW. Hot water can strip the skin of its natural oils, causing dryness and irritation. So we always advise things like short, lukewarm baths or showers in order to have a gentler approach to the skin. Soothing topical creams or lotions can also be applied, and things that contain things like aloe vera or calamine can also help to provide temporary relief from the itching and burning. We actually know that aloe vera in particular has been shown in several studies to have anti-inflammatory effects and help to improve wound healing, so this is certainly something you might want to consider. Additionally, things like zinc oxide paste are known to have a drying protective effect on the skin, especially when it's irritated. It creates a liquid repellent barrier on the skin which helps to provide relief and also stop water from losing from the skin. Oat baths, also known as colloidal oatmeal, are a product made from finely ground oats which have been used for centuries to soothe irritated skin. Think about chickenpox. This is something we do with that. The Journal of Drugs and Dermatology suggests that it works by forming a protective barrier on the skin and overall reducing the dryness and itching in the skin. There are medical therapies that we often use in the management of TSW, and these can also include other things like emollients or moisturizers, which are fragrance-free, therefore reducing the likelihood of irritation in the skin. This helps to maintain the skin's barrier by reducing dryness and alleviating itch, and helping to stop the release of water from the skin. They need to be applied frequently through the day to give relief to the skin and give you the benefit that you're looking for. Try and look for moisturizers with beneficial ingredients with things like ceramides, panthenol or hyaluronic acid, as they can help to promote water retention in the skin. But do remember, some people can be irritated by some of these things, particularly hyaluronic acid if your skin is damaged. Non-steroidal topical medications such as emollients and products containing anti-inflammatory ingredients like niacinamide can also help to calm down red, irritated skin. And this can help to maintain the moisture in the skin while also relieving the symptoms of TSW. There are things that we can also do which don't involve creams. We can use phototherapy, also known as light therapy, to expose the skin at certain wavelengths of ultraviolet light, also known as UV light, under medical supervision. We know from established clinical evidence and practice that this can be a really effective treatment in various skin conditions like eczema and psoriasis. We've used this for a long time in eczema and psoriasis to reduce inflammation in the skin over a series of treatments over many weeks. So it isn't a one and done treatment, but you must be selected very carefully for this treatment. Immune modulators and immune suppressants are also different types of prescription medication which can be used to work to dampen down the immune system's overactivity and reduce the inflammation in the skin, thereby alleviating the symptoms associated with TSW. Examples of immune modulators are things like tacrolimus or pimecrolimus, and these often apply topically, as in to the skin, to give relief and help with the inflammation at the site. Oral immune suppressants like cyclosporin or methotrexate can also be used, and these are typically prescribed by dermatologists or specialty skin doctors if the symptoms that you're experiencing are severe and not responsive to other treatments. But remember, these are powerful drugs with also potential for many side effects. So again, you must have careful monitoring and you must be provided by a qualified medical professional who understands these medications in detail. There are some alternative approaches to managing TSW which are being practiced by people who are dealing with TSW, and I've come to know about them from speaking to lots of patients. So I'm going to talk to you about one of the most common ones I'm hearing about now, which is also known as no moisturizer therapy, or NMT, and how it's used in TSW. No moisturizer therapy, or NMT, is a management strategy in which some people with TSW use this to manage their symptoms. Essentially, the approach is in the name. This implies not using any moisturizer on the skin. Now, for medics, this is a little bit of a controversial one, but it operates on the idea that ceasing the use of moisturizers can help enhance the skin's natural barriers functions and speed up the healing process. Some people believe that the skin is getting lazy from the constant application of moisturizers and becomes dependent on the use of external moisturizers or hydration. So by stopping the use of moisturizer and using this theory, they believe that the skin is forced to learn how to self-moisturize and thereby get better by itself, naturally restoring its function. The process of implementing NMT usually involves many steps, and this is something that you have to be committed to. And it starts with completely stopping the use of all moisturizing products, including lotions, creams, and even lip balms. So you will be extremely dry. Additionally, this also includes limiting the amount of water exposure to the skin. So taking very short, infrequent showers and not soaking in baths. And also in people who do NMT, they're advised to avoid excessive sweating and to stay cool and in a dry environment as much as possible, thereby limiting extra water loss from the skin. As for medical evidence, it's very important to know that NMT is a new concept in the management of TSW, and there are no exclusive studies or controlled clinical trials on its effectiveness in TSW. We essentially call this anecdotal evidence, or the lowest form of evidence from individuals who have used it, tried it, and feel that it works for them. And certainly it's an emerging area, so we'll certainly be looking at it. People who do NMT suggest it can be beneficial, but we do know it's extremely challenging to do practically, especially in the early days when the skin can feel extremely dry and tight. So this approach requires a strong commitment and willingness to endure potentially a very difficult adjustment period. As with anything regarding your health, it is really important that you consult a medical professional for help before embarking on any of these strategies, specifically things like NMT or any new treatment approach for management of TSW. Remember, what works for one person may not work for another, so it's essential to have a professional to guide you and ensure that you are carefully and safely and managing your TSW and getting the most effective strategy with a chosen and personalised treatment plan. Coping with TSW can be an emotionally and physically challenging time for anyone. So here are a few of my tips for managing it. Number 1, patience. Time is a healer. And I know a lot of people hate that phrase, but we know that the process of time can help the skin to heal. And although this can be frustrating, be patient with yourself and with your skin. Your skin eventually knows what to do and will relearn its primary functions as a barrier. Number 2, avoid triggers. If you can identify and avoid your triggers that worsen your symptoms, like hot showers, certain fabrics, or even emotional distress, addressing these can reduce the frequency and the duration of your symptoms. Number 3, support. This is probably one of the most important parts of managing TSW. Dealing with TSW can be an emotionally taxing experience, and various healthcare organisations offer counselling services to help you to manage with the mental health burden that comes along with TSW. Mental health support in the form of cognitive behavioural therapy can be an extremely helpful factor in helping improve your confidence, your self-esteem, and your sense of happiness, and allowing you to be able to heal internally as you heal your relationship with your skin condition. And this is something that can help you on your journey to health. It's a valuable resource to learn how to tackle the different situations that may come up in your life now and in the future that can trigger your condition. And you may be presented with these in future. So learning how to manage this is a really great strategy. There are online support groups that connect others who have this condition and help you to understand your experience, and also to just provide a support system. This can be really beneficial. So you can reach out to support groups like ITSAN or doctors who specialise in TSW for guidance and get emotional support from counsellors. UK-based organisations like the National Eczema Society who offer online forums for support for patients who suffer with this. And you can certainly get some help there. And there are international organisations who do the same. It is important to remember that the mind and the body are closely linked, and you need to seek support for your mind to heal your body. So if you can, seek counselling. Most people who have dealt with a chronic skin problem will often have a lot of built-up experiences regarding the impact of their skin condition on their mind and their life over the years. So addressing these can be really freeing. My personal professional of choice is a psychodermatologist. They specialise in the interface where the skin and the mind interact. They are really worth their weight in gold. So if you ever can see one, please do. If you think any of these management strategies would work for you, then do please talk to your doctor about your decision and how you want to go about it. Create a tailored plan that works for you and get on the road to recovery. Topical steroid withdrawal can be a tough journey, but with the right support and the right care, many people do recover. The journey is long, but you can get through it. Remember, every journey is unique and different, so the time it takes for you and your skin to recover may be different to someone else. So don't be put off by the fact that you are taking longer than another person. If you do suspect or you know that someone you love is experiencing TSW, it's essential to contact a healthcare professional with knowledge of TSW for guidance. I want to thank you so much for joining me and for going into this topic with me. And if you know anyone that could benefit from this, please send this video along to them. I do hope this video has helped you to better understand the condition and to realise that there is hope. If you have any questions or you want to share your TSW journey or your own personal experiences, I want to encourage you to put this down in the comments below. So like and subscribe to our channel for more informative content. Stay tuned for more educational videos, and remember, knowledge is key.